Hi, welcome to WMI Mental Health Mini Series. My name is Gaston Ndagijimana. I'm currently a medical student at University of Rwanda, and I'm currently also serving as Global Advisory Board member. So as we continue to celebrate Mental Health Awareness Month, I'm really excited to share with you an important topic that many people deal with, but on the same hand, they don't usually understand well. That is panic disorders. Okay, so let me start asking you this question. Have you ever felt a sudden fear, like out of nowhere, your heart is beating too fast, you're shaking, you can't breathe, even though nothing dangerous is around? If yes, you might have had a panic attack. And if no, maybe you probably know someone who had. So today, we are going to discuss it then. What is exactly the panic disorders? And what are the signs and symptoms a person with panic disorder is going to present with? And what are then prevention strategies and available treatment for the panic disorders? So panic disorder, as its name implies, it's panic, extreme fear. But in this context, it's an extreme fear without any danger or any threat around. It's actually a type of anxiety disorder characterized by recurrent and unexpected episodes of fear that triggers physical reactions even though nothing dangerous is around. Perfect. So we understand the definition. Let's then see what are the signs and symptoms of a person with panic disorders. First things first, a person with panic disorder is going to present with both physical and psychological signs. Please don't miss them. Let's start with the physical ones. Physically, they are going to feel like their heartbeats are pounding too fast and strong. And the medical term for this is palpitations. Okay? Sweating, trembling, shortness of breath, chest pain, which is often mistaken as heart attack, but it's not. Okay? Nausea and tingling sensations. So let's see then what are the psychological symptoms. So first, it's the sudden onset of intense fear. We've seen that, okay? And this usually peaks within minutes. And it's not triggered by any specific situation. And this differentiates panic disorder from the rest of other psychological disorders. And lastly, but not least, it's fear of having more attacks. Like they complain, like when is the next one? Like they sound like they are more afraid to have the next one. Okay. So how can we then prevent panic attacks? So while panic attack can't always be prevented, but certain strategies can reduce their frequency and intensity. The first is regular exercise. You know why? It helps to regulate the stress hormones and it boosts our mood. The second is practicing relaxation techniques. It's deep breathing and meditations can, help to manage the anxiety. The third, it's please limit your caffeine and alcohol intake, because these two things, they can increase or trigger and worsen panic symptoms. Okay, so the fourth one, try to get enough sleep, because poor sleep it increases anxiety sensitivity and it's really very bad. So the last but not least, try avoid smoking and drugs, because these two stimulants they contain nicotine, which can provoke panic attacks. So then let's see, how do we treat panic disorders? So we combine psychotherapy and medications. So among the psychotherapy, the psychiatrist helps you to identify and change the negative thoughts patterns you have, okay? And he or she teaches you some coping mechanisms that helps you to face that fear. So about the medications, then we combine both. Sometimes one or not another accordingly. Your doctor decides. First, it's long-term anxiety management, and then short-term relief, which the what we call benzodiazepines. But some research shows to have some risk of dependence, but your doctor again decides accordingly. Okay. So we've seen that this panic disorder, they kicks in just in a second. You see, it's emergency. Let's learn then some emergent coping mechanism. There are three. First, try to breathe slowly and try to calm yourself by trying to name at least 5 things around you. Okay. So as I close, I would like to thank you for listening to this end. Let's keep supporting each other, learning together, and working to make mental health care more open and acceptable for everyone.